without losing yourself. And I wanted first to tell you a little bit about Elderworks. We are a 501c3 not-for-profit, and our primary role is to help seniors in any way we can to do placement in retirement community, assisted living, memory care, skilled care, and home care. We also provide an inordinate amount of resources, and those are always available online in our Elderworks directory. In addition, we do continuing education for nurses, social workers, nursing home administrators, as well as the general public. And today's presentation has been written by Jennifer Prell, the president of Elderworks, and I am presenting these slides and kind of putting in my own experiences in certainly being in retirement living for over 30 years, as well as my own personal situation. And when we're done with the slides and I stop screen sharing, then we can have our own discussion for whoever is on the call. Just a few people had signed up, but we're on Facebook Live, and it really helps the public, all of our events. So I wanted to thank everybody at Elderworks for the opportunity to be able to educate the public, to Emily Grosinger, who runs our office and really is our backbone in helping us do all of these wonderful presentations. So thank you, Emily, and thank you to the few people that are here on the call. So we'll go ahead and start out with some of our slides. So the first thing I will say is that I personally have a mother in memory care inside of 12 years and in a community for over 7. And being from 4 children, there's always sometimes 1 or 2 that sort of do everything, and the others are either out of town or they're not as involved. And many times it depends on your relationship with your parents or your loved one, just in terms of caregiving. And so in as much as my own mother is in a facility, there was a time that she was at home and we had to get our ducks in line. And so on this slide, for the tips, techniques to reduce stress, organization is key. Knowing where everything is in terms of not only just supplies and keeping a home organized, to know what is there for the caregiver with food and the proper housekeeping, but even things like being organized to know where powers of attorney for healthcare, powers of attorney for property. Those 2 documents are essential for any senior, and to have those done, to have a will done, to have everything done properly, because oftentimes these things get caught up and people don't want to talk about it. I guess I refer to it as the God forbid book. And once the God forbid book is put together and everyone knows where it is, then there's no question. So just in terms of organization, that's totally key. And making sure now that there's enough personal protective equipment in the house, if it's masks and gloves, if it's a gown, if many times if you have a home care agency helping your loved one, they're coming in with those supplies. Sometimes there's an upcharge for those things, but just making sure that the house has everything that it needs. And just the other thing, and in tandem with that, is just setting some downtime for yourself, just to breathe, just to remember that, you got to center yourself in order to go forth, because, the old adage is that the caregiver has to be taken care of, because the patient, the family member, is going to get loved and cared for and their needs met. But you got to just watch yourself, to sit and meditate, to go and breathe, to sit up straight, use your diaphragm and do that breathing in the nose, out the mouth. It's a really, really good tip. Caring for a loved one is stressful, to say the least. I think it is the biggest stressor in the whole wide world in so many ways. And, I guess focusing on that person as they were, and what your relationship was, and focusing on those things, or certainly as a caregiver, getting as much information about that person So, for example, with my mother's home care people, we show them pictures ahead of time. We tell them she went to Radcliffe College in Cambridge. She worked for Eleanor Roosevelt. We tell them a lot of things about her so that when it's just in terms of that kind of role, in terms of caring for them, you have a little bit of backgrounds and a little bit of understanding because the real person sometimes, even when someone has all their acuity about them, they had a whole life. And I love that poem, the Dash poem, because that dash, between the time someone was born and the time someone passes away or has not passed away yet, that dash and what they did in their life really helps you care for that loved one and maybe not make as much as stressful because you need to know who they are. And the focus is on the person you're caring for. Is what you're doing benefiting them? And always, what about, again, we go back to ourselves while we're doing that and staying healthy and just, really thinking about, if it's 5 minutes or 10 minutes to get up and walk around the room. There's stressors. You can, pinch your wrists, you can pinch behind your ears, you can take an ice cube and stick them behind your ears, but you need to take a moment and really try to omit the noises in your head and the drama behind the times and try to omit the cell phone, the phone calls, the social media. Sometimes that's a little bit much. Again, the no drama logo. Love the no drama logo. Surrounding yourself with supportive people, positive people that are adding to your life. Oftentimes, I call it the well one eye syndrome. So you tell someone something about what you're going through, and what you need to hear is, I understand. I understand. And oftentimes you could tell a whole story about your day, and then the person that you're talking to says, well, when my mother, and well, when I, and so, you're not there to take on someone else's problems. You're there to be listened to. And it's okay to tell someone, you know what, right now, my plate's full, and it's real hard for me to take on any other issues. So just letting you know where I'm at. Because when you're a giver, I think I came up with a phrase a while ago. It's sort of called the booby prize. And if that's your nature to give, when you're a caregiver, and to maybe give too much as a caregiver. Welcome to whomever is just coming on. I'm not sure you're connecting to audio, so welcome. And we're just talking about being a caregiver and taking care of yourself, and we're on a slide about just keep yourself away from the drama, do your breathing, and try not to take on other people's problems. There's the various, this is kind of a fun slide that Jennifer had added because, the stages in life, there are 3 stages in this life: youth, middle age, and gee, you look good. Bob Hope was so funny back in the day. It's like the old story that, we couldn't wait for the next birthday party, when we were 6 and 7 and 8. And oh my gosh, my sweet 16 and all these fun things, my 25th, then the ages start to become, I'm going to be 80, I'm going to be 65, I'm going to be. So the gee, you look good, take the time to put the lipstick on, to put on a pretty necklace, to brush your hair. The story with caregiving is that it just can take so much out of you that you need to really do things that will perk you up. And I know in the format that we're in with siblings and with friends and with the Zooming and with our work and our business partners, try to just, do something that makes you feel good as far as, your appearance, because sometimes that makes your insides feel better. And if that's adding a pair of earrings, it's funny. The other night I'm laughing that I'm saying this because for formal affairs, I like to do false, just pretty false eyelashes and not a lot of makeup. And I was very worried that I was not going to be able to know how to do those. So I put my false eyelashes on the other night for a Zoom. That was my makeup, and that worked out really well. So just try to do nice things for yourself. Um, the old story, if you like, if mom liked you best, you're probably her caregiver now. And the one that mother feels emotionally closest to and thinks she's most similar, sometimes those connections are there. And I don't know, if you share attitudes and values. She the one who's provided support and help for mom in the past, the one that has been leaned on. In some cases, I'm the third of four, so at some level, I took on the power of attorney for healthcare for my mom. My fabulous older sister does all of her finances and things like that, and we have two siblings that are out of the country. But uh, and my mother loves all of us so equally and was an amazing mother, and still is. But the big thing is that you are who you are in the family. And some people come to Elderworks and say, I'm it, and I have 5 brothers and sisters. Sometimes that's all about the relationship. So that is what the story about that slide. Different survival tips. And this is a really neat slide. 10 pieces of survival to plan ahead, to take a day at a time, to accept help. That's a big thing. Accept help. If someone says, what, can I throw in a dinner for you guys, or can I drop some lunch over? You don't need to always say, oh, no, that's so sweet of you. And I can accept the help, say, that would be really, really nice. And people, good people don't expect things back, but great friendships will always last. Get enough rest and eat properly. Super important. Try to get a good schedule down for yourself. Eat the breakfast, the lunch, the dinner, the snacks in between. Watch your sugar. Try to move. Try to move. If it's 10 minutes, if it's 15 minutes. When they say 30 minutes of exercise a day of cardio, you can do 10, 10, and 10. Try to move around and be good to yourself. And learn about available resources. Call Elderworks, 847-462-0885. Call us anytime. We have resources. Call your senior center. There's a lot of direction there. We put out a directory that's got so much about Medicare, Medicaid, many, many questions in there, and you can see it online under resources. Develop contingency plans. What if something happens to you? Who's going to come in there and help out? And are there means? Are there means for home care? Are there means for all of these kinds of things? And make your health a priority. Make your health a priority. We've talked about that. I can't stress that enough. Making time for leisure. And sharing your feelings with others. Always find people that you can express your feelings to, and someone that you really trust and feel good about. This is a really incredible slide. What prevents us from planning ahead? It's sort of the ceiling upside down laying, and I think the slide's actually flipped, but I apologize for that. But it's still the whole idea of, I need help. And some people get frozen. Some people get really frozen from planning ahead. They get scared. I think the biggest thing and the biggest fear is that a lot of people do not do planning. Our generation, if you're in your 40s, 50s, 60s, to have long-term care insurance, to look at maybe what your parents did well or didn't do well in order to save for those kinds of things. And you have to plan ahead, and otherwise, you can very easily curl up in a ball, and it's a big problem. So, you never want to feel like you're being judged by anyone as well. But find those people to help you, find those resources to help you. We had somebody that called Elderworks today that said, gosh, I can't sign up for Medicare or Social Security, that no one will, there's no offices open. What do I do? They can't talk to me till January. We're offering our office here or there for someone that needs help with a computer. We've reached out to a Medicare specialist, one of the hospitals, to see if she has some answers to help this person. So, planning ahead is really important, but, again, use your resources, and you can always call Elderworks. And this is just a fun slide, just to, roll over. I'm depressed. This is depressing. And kind of a funny slide of an upside down puppy or a rabbit or whoever you want to call it. And never give up. You need to stay positive. And those things are all really important for your cortisol levels. Your cortisol, your stress hormone. You don't want to have those stressors in your life that cause depression, because depression is very real. Caregiving can be very depressive and very difficult, but there's just a way to look at it, and there's more than one way of doing things. And so get help if you need to get help. Speak to your primary care physician, who might be able to make a referral for you, and just stay on top of how you feel, because we all know how we feel. Learn about local resources. That's the Elderworks directory for 2020. Our new one will be coming out in March of 2021. But your township and state services, if you need a geriatric care manager is a specialist who can really help. If you have a real social service issue, you have a person refusing help, you have a person that's hoarding, you have a person that is in a very, very difficult situations, a psych situation, oftentimes a geriatric care manager is the right person to go to. Certainly Elderworks has resources for those. Some of the senior centers work with geriatric care managers. They do charge for their time, of course, and they can help figure out, if there's credit card debt, if there's bills that are piling, things like that. They can work on those kinds of things. There's so many support groups. There's so many support groups online. All you have to do is look and find those things in your social networks. On Facebook, there's, look in your community, join those Facebook sites. Social media gets a bad rap, and it shouldn't get a bad rap, because some of the greatest resources have been coming out of there as well. The townships, I can't tell you the number of calls that we get from all the various townships. I've got Northern Lake County and McHenry, between senior services and Crystal Lake, between Ela Township, between up in Gurnee, Grays Lake, unbelievable. Avon Township up north is my area, certainly, and then all of my coworkers in Carol Razzo and Tamara Cruz and Gelnixick, we all have different areas, and the townships and the senior services are super helpful. And many times they're referring back to Elderworks for senior care, home care, and other resources. But at the same time, use the resources out there, and they're there for you. These are the greatest 4 words, can I help you? And oftentimes that's just what people need to hear is, can I help you? That's what you want to hear, and that's what you can ask for, and that's what you would certainly talk to anyone that that is in need. Can I help you? Too often we underestimate the power of a touch, a smile, a kind word, a listening ear, an honest compliment, or the smallest act of caring. Always love Leo Buscaglia. But I think one of the takeaways too is that in the course of listening to so many of the Elderworks presenters at the various events that we host, the one takeaway that I got is that, for example, in memory care, the hippocampus stores the I was at the racetrack the other day. I drove over to the grocery store to pick up XYZ. So that's storing kind of all your memories. The amygdala is housing all the feelings. And so you need to that's the part that's so important, is to accept accept those kinds of touches, and to do that for other people too, because you never know. The most important part, and I guess the biggest takeaway from today, is that you do not know what someone really is going through. A person can appear to be so positive and so together, and they could be broken inside. And everyone is entitled to have those weaknesses. And so I think that the idea of, can I help you, and I'm there for you, and it's okay to not be okay, and just to be kind, and to keep that in mind for any caregiver, and not to overthink things. Do the little things, find your happy. If you can, get in the car and take a drive. If you feel like a certain kind of wonderful food you haven't had, just do a drive-by pickup, if you're doing that, or pick up at the grocery store something really special. I like to splurge on the strawberry toasted almond salad at Sunset Foods. I'll have them put that in my Instacart in the back, and just, if it just going, and sitting in a bath, or just doing something nice for yourself. Go take a walk, any of the beautiful forest preserves, all year round. Try to find a day of the week, if you are a caregiver, to get a replacement, if possible, somebody to help you, even for an hour. You and you and you might want to tell this to, employees of yours, or to a parent of yours. You always have to look out for the healthier one. That's the most important thing, is that the patient or the loved one's going to get cared for, but you just got to watch out for the healthier one. And so those are just some simple tips. And making your health a priority, physical activity. um, Gosh, get out there, take a little walk, go sit in a chair across from your computer and do some leg stretches. Go on YouTube and Google, simple chair exercises, 10 minutes. It's all on there. Everything is there, or on a television. And you got to move. People avoid exercise. It's a common thing. Obesity in this country is really a big issue, and you just, anything to do to move. And schedule, keep yourself together, keep your doctor appointments, keep your dentist appointments. It's important to have hair cut. It's important to have nails clean. These are essential services. And currently in COVID, all the proper PPE is being done. And some people may have opinions about that, but those to me are essential services, just in terms of that. Schedule Zooms with your family members to just say hello on a Friday night or a Saturday night. And plan time just to have some leisure, just have something to look forward to. Always have something to look forward to. And managing your stress and sleep well, which I've talked about before. I think screen time, too much TV, too much phone in your face, that light, can really affect your sleep. So that's something to be really careful of as well. Be good to yourself. Use your good china. Pull out 4 place settings for dinner, or 2 place settings for dinner, or 1 for yourself. Use it. Otherwise, it's just going to sit there. Your china, your silver. Just break it up a little bit. Like I said in the beginning, put on some makeup, wear your good clothes, wear a pretty blouse and a pair of slacks. I put on a pretty summer dress that I love, and my grandmother's necklace today, just to feel kind of perky. Turn off your phone. It's okay to turn off your phone. It is absolutely okay. If you have a loved one in a place and you're concerned about, about them, and someone's trying to reach you, you can always watch your screen, but just turn your phone off. There's always time to do that, and find a quiet place. And always remember this: there's always someone to talk to. You are not alone. You are not alone. And you can be, firm with people. You can be honest and gracious by saying, gosh, I can't handle this. And this is what I'm able to do right now. And try to try to laugh, try to find ways to laugh, or look up a laughter therapy program. There are laughter therapy classes that are so fun. Again, you can find those on YouTube, you can find those anywhere. Take a laughter therapy class, forcing yourself literally to laugh. If you're driving in the car, the next guy might look at you like you're insane, but it's really good for your endorphins. It's really good to for that stress hormone to laugh and to force yourself and ask yourself, how can I take care of myself? What are the things that I can do? Who are the positive people in my life that can make me feel better? And limit your conversations with those that don't make you feel better. I think this pandemic is going to really, really, really show us who our friends are and who we really, really depend on and who we love and who makes us feel good. Creating boundaries. Generous people set boundaries. If you don't set boundaries, you're giving yourself away. With boundaries, you only give what you want, which means you can afford to be generous to more people over a long period of time. And so, creating those boundaries is super important. Much of the time, and I talked about this in the beginning, the well when I syndrome. The well when I syndrome, where a person's going to go bound off into their problems, is, you don't want to cut somebody off, but sometimes it's just not helpful. And so, you can talk to a person. You can, just don't overextend yourself while you're having to, care for people, while you're, working the way you do in a community, if that's what you do. And so creating those boundaries is a very important way to literally improve your life. As a caregiver, I have the right to be treated fairly and with respect. I have the right to feel safe. I have the right to feel included. I have the right to be heard. I have the right to make my own decisions. I have the right to ask for help when needed. I have the right to set times for calls and visits. And I can say no to unwelcome behavior. And that's really important because there's always a dynamic in caregiving. And these are respect, safe, included, heard, decisions, help, time, and behavior. These are all incredible, incredible areas to think of. And take a picture of that with your phone, because that's what a lot of this is about. And again, this is sort of the bubble of boundaries. People might get angry. What do you need and want? Boundaries are not selfish. Make decisions without guilt. Don't apologize for boundaries. The guilt piece with caregiving is big. Also, hoping you're on the same page with siblings, with relatives, and, again, not being afraid to make those decisions that you need to and not second guessing yourself. It's good to run things by people, but this is a real important piece within boundaries. And goals for caregiving are meant to be set, but the direction to get there can deviate. And so it's important to know what you're going to be doing at the beginning of the day, to make for a successful day or a successful week. And break it up a little bit. Come up with new things to do. You cannot speak to somebody who, for example, might be in memory care who doesn't speak anymore. So if you walk around and you say, Mom, this was the coffee mug from Starbucks I last got you for Christmas, or, this is what holds our phones nowadays, Mom. And you hold things up. Mom, you were a great writer. There's a pen. Mom, you had a fountain pen that looked just like that. You kind of have to recreate it. And so that's important as well. Again, we're on our goal setting, and I started to go into that, where you set it, you make your plan, you get to work, you stick to it, you reach your goal. And those goals can be for the person you're caring for. Those goals can be for yourself. How are you going to start your day? How are you going to work on everything and setting your plans? And so goal setting is really important in caregiving. And asking for help, that, all of the different stages of asking for help. What do you need help with? Think of who might be able to help with that. Be honest and direct about what you need, and lower expectations. Lowering expectations is a super important piece to this, is that, if you don't expect, then you're not going to be disappointed. So watching your expectations of people, I think you should assume good intentions of most people, and certainly the people that you should be with in your life. But just being really careful of those expectations. Managing your family, medications. Just in terms of the house or the room or whatever, separating medications into bins, putting daily items in the same place every day, putting emergency information on the refrigerator in your wallet, any allergies, any legal documents should be available. Stuff happens, cover yourself. Do not put things in a safe deposit box. Nothing should be in a safe deposit box in terms of a will, in terms of powers of attorney for healthcare. These things should be at your fingertips, or somebody in the family that you trust needs to know where those things are. Put them in a red folder. Tell them they're in your underwear drawer. Tell them they're in, the bottom drawer of the kitchen. Very, very important that they should be readily available and not in a safe deposit box and not hidden where no one knows. A lot of seniors do not want to have these conversations. It's very hard for our elders. The World War IIs are still around. The Korean Wars are still around. There's a lot of, if you talk about it, something bad's going to happen. And so really try to get through that nut. And if you need to use an elder care attorney, or you need somebody to help you with these conversations, then so be it, and find that resource. That was my last slide. And I want to, thank you for listening to all these wonderful tips. Again, thank you to Jennifer Prell, our president, who wrote this presentation, and I certainly added my own thing. I'm going to stop the share. Emily, I might need help with that, so that we can all just talk.
Do you have the little toolbar that you can stop?
Yeah, it's actually just below.
Or if you close out of PowerPoint, it will stop sharing your screen.
Yeah. Okay. It's funny, I can't